to talk about doula support and my role as a doula. So what is a doula? In Greek, the word doula means woman's servant, and a doula provides physical, practical, and emotional support during pregnancy, labor, and postpartum. There are common misconceptions and questions about the role of a doula. I am often asked, what is the difference between a doula and a midwife? There's a big difference. The midwife is acting as your care provider. If you're having a home birth, midwife is taking the place of the doctor or OB, and in the hospital you might be having a midwife in the hospital that takes care of the delivery and really manages the safety of you and baby during labor and delivery. And the doula is there to help you cope with labor, help to suggest position changes, help you to cope with the intensity. I teach pain coping practices instead of relaxation techniques, and I talk a lot about the difference between relaxation techniques and pain coping in other videos and blogs. But it's really important for a doula to help you to remember what you've learned prenatally and ways you've learned to cope with pain and intensity, and help you emotionally and mentally navigate labor, and also to help you understand when labor is normal or abnormal, and to help you and your partner to really ask questions of your care provider and to help you navigate all the pros and cons of possible interventions that might be discussed, and to help you to really stay present with each contraction and help you to really stay out of your thinking mind. I teach a process called labor land, and when a woman gets into active labor and the transition of labor, it's very common for you to get into this labor land state where you really don't know what's happening externally, and it's hard for you to make decisions and to understand in your thinking mind what's happening. And that's where your support people come in, your doula comes in. It's important that your doula and partner are comfortable with seeing you in pain. If you are wanting a low intervention or unmedicated birth, you will experience pain and being uncomfortable, and part of that is normal with labor. And your doula and myself are very comfortable with seeing a woman in pain and understanding the difference between pain and suffering and the pain coping mindset. I teach a lot about knowing the difference between pain and suffering and the mindset of coping with intensity. And I'm comfortable in that space. It's even hard for support people or partners to be comfortable with that. So I help partners to understand what's happening, and watching and observing my energy, partners realize this is normal labor, and helping you get through that intensity and recognizing this is pain and this is normal, and helping you to keep going when you're in that transition place, and reminding you of practices, watching your energy and talking you down, helping you breathe through it, noticing where you're carrying tension, and that is part of a doula's role. Another question I get is, do you only do home births? I support people wherever they are planning to birth, whether you're in a hospital, a birthing center, or home birth. I also support your partner. Sometimes people tell me that they're concerned that I'm going to take the place of their husband or partner, and I want to change that misconception that I really support your partner, and to help your partner to support you and give your partner ideas of how to support you. And it's my desire that I partner with your partner or husband to fully support you and to give ideas and to give your partner breaks. Your partner is going to be exhausted and not know the pros and cons of different interventions that might be discussed, and your partner may not remember everything you've learned prenatally, and I can be there to help remind you of things. And it's important that your partner really feel connected and feel freedom to be emotional during your birth, and not feel like that he or she has all the expectations to help you and navigate everything and to remember everything, when he or she can really experience the birth of your baby together and allow me to remember all the external aspects of your birth. And it's so valuable to have someone with experience in birth to help you navigate all the emotions and anxieties that might come along with labor and birth, and your partner is going to be experiencing and feeling that too. I want to talk some about how I interact with care providers and the nursing staff in the hospital. I know my role as a doula, and I'm comfortable and confident in my role and knowing my boundaries and what I do as a doula and where it's outside of my scope of practice. I don't do any cervical exams, medical checks, blood pressures. That is the care provider and the nurse's role. I don't touch any monitors or anything in that space. I am there to help you and to suggest position changes and everything to help you navigate labor. And the nurse or care provider are doing all the monitoring, and they might help in some ways with your labor and suggest different things. And we work together as a team, and I don't feel intimidated by somebody suggesting something about your labor. And I make it clear that I am not there to take over or run the show. And I might tell the care provider, I am thinking about doing such and such, maybe when he or she is out of the room, and I'm bringing everybody on board with what I'm thinking and how I'm helping support you and maybe what we've talked about prenatally. And we are all there together as a team to really help you to have the experience that you are comfortable with, that you feel empowered, and that you enjoy your birth experience, even when it's intense and even when things might shift that might be outside of our control. That is my passion. That is my desire for you as your doula. You'll find on this page a bullet point list of my services, and as I have gained more experience in the birth space, I have realized that my intuition has greatly increased. And there's a bullet point list, but as we know, everyone is different, every birth is different, and it's so important and valuable to have that deep, strong intuition to really know what you need, what your partner needs, and what your birth needs. If you're not local to me, I also offer virtual doula services. So you can look below and find the button to learn more about my virtual doula services and to have me a phone call away. We can do a video, Skype, or Zoom call during labor to help you navigate different concerns or questions that might come up or interventions that might be talked about, and even to have me talk you through contractions and to help your partner navigate everything that's happening. So if you don't have a doula local to you that you feel comfortable with, or maybe you don't want an extra person in the room, then look at my virtual doula services and set up a call with me, and we can talk about how I can really help you, and also find my childbirth and postpartum courses and how I can help you prepare prenatally for your birth experience. If you are local to me, find the button at the top of the page to message me, and we will schedule a time to meet. I look forward to meeting with you and supporting your pregnancy, birth, and postpartum journey.